This presentation will cover the advancements in the medical field, specifically focusing on the practice of dermatology and a device that has simplified the diagnosis of skin cancer. Skin cancer is the most common form of cancer. Doctors have determined that sun exposure can lead to increased chances of an individual's risk for skin cancer. Even just a slight sunburn that occurs once every 2 years can triple a person's chances of getting melanoma skin cancer. And melanoma is the deadliest and most dangerous form of skin cancer. It affects approximately 73,000 people in the United States alone each year. That's not even taking into consideration the people who are affected in other countries. Quite a few of these cases will end fatally. However, the key to treating melanoma is early detection. The sooner that you identify the skin cancer on your body, the sooner that you can get it removed. This graphic presents images of melanoma compared with normal lesions and moles that you can find on your body. This is a really good way to determine if you think that a lesion on your body is cancerous. And once you have discovered that, the best step is to go to the dermatologist. Once you identify that there is a possible lesion, go visit your doctor. What your doctor can do is they will look at that lesion and they can determine if there is a possibility of skin cancer. But that is all they can do. They can only look at it and determine whether they think it could potentially be melanoma. In most cases, the next step would be to take a biopsy. And a biopsy is whenever the doctor will remove a layer of your skin from your body, from the infected area, and they will take it to a lab and they will look at it under a microscope and determine whether it is cancerous and if it is melanoma or not. The problem with biopsies is that they can often leave scars and can be very invasive. Depending on the size of the lesion and how deep under your skin it goes, the doctor may have to remove a large portion or a very deep portion. In recent years, a new invention has been created called the MelaFind. What this device does is it scans the infected area and it produces an image, a 3D image of the lesion, and all this just takes just a few minutes. And it's provided to the doctor on a screen. The doctor can look at this lesion, and not only does it provide an image, but it provides a clear results of whether it is cancerous or not based on how this lesion looks. And it does this based on a database of around 10,000 images of melanoma and skin disease. And all of these images were qualitatively assessed by doctors and physicians who have studied melanoma intensely and have a clear understanding of the visual markers of these malignant lesions. This is an image of what the MelaFind actually looks like. You can see the screen where the 3D image is displayed. You can see the handheld portion. It's very easy. You just pick it up and just place it over the lesion for just less than a second, and the image pops up on there along with the results for the doctor to review. So, the MelaFind was tested using two qualities. Sensitivity was one, and the sensitivity of a test is the way that a test, how often it correctly identifies that a person has this disease. The problem with sensitivity is that it can also provide false positives. However, the MelaFind had a sensitivity of 98.3%, which means that 98.3% of the time, the sensitivity correctly identified that a person had malignant cancer, malignant skin cancer, and only 1.7% of the time did they incorrectly identify that a person has melanoma. Another quality is specificity. This means that a test will identify that a person does not have a disease, in this case melanoma. And in this case, you can see that MelaFind was 2.5 times more accurate than actual dermatologists that it was compared with. So the combination of sensitivity and specificity taken into account with the MelaFind, you can see that it is a extremely accurate test and that it can identify correctly and that a person has melanoma, and it can also identify that they do not have melanoma. The benefits of this MelaFind is that it can help dermatologists make much more informed decisions. It is not meant to replace biopsies completely, because biopsies are still very important, and 100% accuracy when it comes to determining whether a patient has melanoma or not. What the MelaFind does do is it promotes faster and easier diagnosis for patients, and they will not have to endure, scarring and invasive procedures of biopsy when it's not necessary. It's just amazing to see what the advancements in medical technology are doing for our patients today. Thank you for listening to our presentation, and I hope you found